Hello, everyone. I hope you can all hear me. So this week I'm a little bit tired, so I'm not going to go on as long as I normally do. I'm going to try and keep this relatively short and sweet. But this live stream is called Digest and Purge, and I'll be talking about some of the sort of Renaissance and medieval medicine strategies. So this approach of using plant medicines to first digest humours and then to purge them is really ancient. It goes back to the ancient Greeks, probably even before then. It was used in medieval times and it was used all the way up to the Renaissance. And I'm going to be quoting from a couple of Renaissance texts. This is Richard Saunders' Astrological Judgment and Practice of Physic, my very battered old copy of that, and Robert Burton's very famous book, The Anatomy of Melancholy. So I'll be diving into those a little bit and talking about this traditional approach. But just before I do that, just the usual disclaimer. Obviously, this video, this stream is just for information and entertainment purposes only. If you have any serious medical conditions or any issues going on, please go and see a qualified medical herbalist or a doctor. Get proper treatment. In other words, don't just take it off the internet. So anyway, that disclaimer over with, I'll get into it. So what I mean by digesting humours is that in sort of ancient times in the West, so the Greeks, the Romans, the Arabian physicians, and the medievals as en masse in general, and in Renaissance Europe, they used this humoral system with 4 humours based on the 4 elements from Aristotle's philosophy, from the Greek philosophy of earth, air, fire, and water. Although I think Aristotle was more about the primary qualities of hot and cold and the secondary passive qualities of damp and dry. But anyway, I digress. 4 humours, earth, air, fire, and water, the 4 elements rather, and they corresponded to 4 humours or substances which made up the body. Fire was choler or hot and dry. Melancholy was cold and dry, and that would correspond to earth. Water corresponded with phlegm, which was cold and moist, which made things slippery and helped to eject them from the body. And blood was hot and moist and corresponded with air. So this was a whole system. And if you read about it on Wikipedia and places like that now, it's sort of it's described as a sort of obsolete system, which in many ways it is. But it's sort of characterized as almost comical and foolish that our ancestors thought like this. Sort of not always, but there's a sense of it's talked down to, which is interesting because it's no different in its sort of philosophical underpinnings than, say, traditional Chinese medicine or Ayurvedic medicine or any of the other traditional medicine systems that are empirical, that are based on observation, that have similar kinds of approaches where you're not looking at the pathophysiology, you're not looking at physical causes. What is being done is describing a pattern, symptoms as patterns, and sort of matching those patterns with patterns of treatment. And in medieval times and ancient Greek and Roman times, they would correspond these physical patterns with astrological ones, with stuff that was going on in the sky. And of course, scientists may argue that that is a spurious correspondence, but nevertheless, that is what they did. So here's from Richard Saunders' Astrological Judgment and Practice of Physic, written in 1677. He talks about, for example, the planet Saturn in the astrological sign Leo corresponding with a mixture of melancholy, the cold, dry, earthy humour that was seen to be, it caused retention, and it was quite toxic in excess. You only wanted a bit of it. In Leo, which was traditionally a fire sign and therefore would increase heat or choler. So he described this as a mixture of outward melancholy rather, so cold outside, hot inside kind of thing. And he said Saturn in the last 6 degrees of Leo is hot in Principio Tertii, meaning in the 3rd degree, and dry in Principio Quarti, 4th degree, causing the plague and hot pestilential and burning fevers of thick yellow choler mixed with melancholy and superfluous phlegm, the dry temper doth exceed. It also causeth the fever hectic, which is a consuming fever, and reigneth in the belly with a pain or stitch in the side. So what's going on there is he's sort of saying, when this planet is in this place in the sky, these kinds of things will be happening to people. What he didn't mean was that those kinds of things will be happening to all people, because the way this was actually practiced was a lot more subtle and context dependent. I sometimes think that people think our ancestors were all idiots. And in actual fact, while they did some very questionable things, there is a baby bathwater problem here. Some of the stuff they did was actually quite subtle and nuanced. And I think some of the ways this was employed was a bit more subtle than people give it credit for. So in this instance, for example, yes, the cookbook, his textbook here says that Saturn in this sign causes these medical problems or aligns with these things. In practice, what I think they'd have been doing is, when Saturn was in that place in the sky, they'd have been looking out for those kinds of symptoms, and of course matching them up with the astrological charts of particular moments and events and so on. But really, it would be, if we're looking at it from a purely scientific and skeptical lens, which I am not, I am an astrologer as well as a herbalist, so I love this stuff. But let's say we're just looking at it from a scientific lens, they'd have been doing a sort of standard reasoning error. I can't remember. I think is it the Barnum effect it's called, where essentially if somebody says yellow car to you, you'll see a lot more yellow cars. So if they're looking out for these things, they'll see more of these kinds of symptoms in their patients potentially. And I don't think that's necessarily a bad thing. If that is just what is going on, if they then spot these symptoms more and treat them, they have a set of remedies for these set of symptoms. So for this Saturn in Leo constellation of symptoms, hang on, I've lost the place in my book now. Saturn in Leo constellation of symptoms, he recommends different plants. So what they do is they'd recommend plants or medicines that digested melancholy and digested choler. And what was meant by that, so sorry, I'm a bit stumbly tonight because I am really tired. It's been a long week, so please bear with me. What was meant by that was that these remedies would take a little bit of time to work. Digestion was administering of more gentle medicines, and this was done for a few days or even weeks at a time, and then they'd give a purge, a more strongly acting medicine that would make the person go to the toilet or vomit or something like that. And this was seen as sort of, first of all, cooking the disease out, or cooking the unwanted humour out of the body to rebalance the humor, and then it was sort of like finally ejected with a forcible slap now, which is the purge phase of it. Now, what might actually have been going on is, with these, in terms of physiology, with the initial more gentle treatments, you're probably just treating things more like we would nowadays, with standard medicines that might reduce inflammation, or that might reduce pain, or that might improve mood, or do whatever, or be antimicrobial, whatever. And then your purge at the end of it would be, I think, again, looking at this skeptically, it might be a twofold thing. You might be, the drama of that intervention would enhance the so-called placebo effect, which is really one of the most important things in medicine. It's the effect of the mind and the body, which are in fact one unit. They're not separate. But it enhances that psychosomatic efficacy. We know that the placebo effect is a very deep rabbit hole. It's very powerful. So, and one of the things that happens with it is that the more dramatic or medical or significant an intervention is, the more powerful it is. And there was a very famous placebo experiment conducted in, I think, the 1950s or 60s, which would be totally unethical today. It'd be ruled out by any ethics board, where an operation was performed on a bunch of people with angina, which is a cramp of the heart muscle. Um, and they didn't know whether this operation worked properly or not. So they just divided people with angina into two groups. And one group they performed the operation on. The other group, they just cut their chest open. So they put them under anesthetic, cut their chest open, didn't do the operation, and then sewed them back up. So both groups had had major surgery. And as far as both groups of people were concerned, they'd had the operation, but only one group had. And what they found was that both groups of people had an equal degree of recovery. About 70% of people in both groups recovered and had no more angina. This told the researchers two things. One, that the operation, such as it was not doing anything. Like, that medical intervention wasn't effective because the people who'd not had it recovered just as much as the people who had. But two, it showed that the fact that all of these people had been anesthetized, had been cut open, they had undergone surgery, it's just they hadn't had their hearts operated on. The fact that they had this dramatic surgical intervention was enough for all of these people, like 2/3 of them, to recover fully, despite the fact that their hearts were in functionally no better shape than they were before, which is incredible. Now, the placebo effect doesn't work for everything, but there are dramatic instances of it causing fantastical effects. But it's active for most people. There isn't one type of person who is a placebo responder. It can work with everyone. So that's a really dramatic. So having the purge in this traditional sort of digest to then purge thing, the purge phase would be a way of recruiting that mind body medicine placebo effect thing, much like perhaps ritual in traditional medicine might be. This is, again, I'm looking at this from a very skeptical, very scientific point of view. The second thing might be that it's actually doing something physiological with the purge other than just causing vomiting or going to the toilet or whatever. It could actually be helping the body to flush out substances which might be causing irritation. Although I think what may be more likely is, rather than just flushing out substances, because the body's doing that all the time, and yeah, for sure, a purge would do that a bit more aggressively. But if they'd had a few weeks of so-called digestion, of treatment by other remedies, then presumably, a lot of the situation would have been sorted out. It may be that they're getting rid of extra inflammatory stuff, but my suspicion is that it may be something along the lines of the purge triggering the release of certain, I don't know, endorphins, or causing some chemical changes in the body itself. Like, after you've had a good poo or thrown up or something, there is a sort of feeling of lightness or relief after evacuation. And I think that which is which is caused internally by changes in your brain and changes to your physical chemistry. So I think the purge might have been doing that, and it might actually been that change in sort of mood and in the body's chemistry which affected further healing. I don't know. This is all speculation on my part. But so in terms of that Saturn in Leo thing, they digest melancholy and choler. So they mentioned some plants. Saunders mentions some plants to do that. He says, digesting melancholy. I'll mention a few of the plants here. He says borage, chicory, polypody. He mentions a few others, but I'll talk about those. And dodder, epitheme, he calls it here, which is cuscuta epitimum, or dodder of time. But so borage was traditionally an antidepressant, very gentle antidepressant. There had been some in vitro, like lab work, showing that it binds strongly to serotonin receptors. So that's, and it also, the oil of borage seed oil, very high in GLA, gamma linolenic acid, which is anti-inflammatory, interrupts a pathway for manufacturing an inflammatory substance called PGE1, prostaglandin E1. So that's an interesting one. The chicory is a herb that activates liver metabolism. It's a Chicoria intibus, or Cichorium intibus, I should say. Very interesting plant, some bitter compounds in there, sesquiterpene lactones, which stimulate liver metabolism and bile output. So that might be um, digesting melancholy in the sense of enhancing liver metabolism and clearance through the liver by speeding up the metabolism of any cytokines. Those are substances which increase, which can make you feel more depressed, or just clearing out by speeding up the liver metabolism. You're going to be speeding up the detoxification pathways in the body. That's a whole other video, the detox thing, about the truth about detox, so to speak, because I've heard a lot of YouTubers and people of a skeptical bent saying there's no such thing. Well, I beg to differ. Your body's doing it all the time, and there are certainly plants and substances which can speed up detoxification. You can enhance phase 1 and phase 2 liver metabolism, for example, so the cytochrome pathways in the liver. Anyway, I digress. Polypody, that's a plant that I love. A polypody root was a mild, and is a mild laxative with slightly anti-inflammatory effects, and that also seems to have a slight sedative effect. So some of these herbs that digest melancholy, they could work in various ways. You've got things that can improve liver function, things that might be slightly antidepressant, things that might be slightly laxative. You've got a variety of things there. And then in terms of the purges, he talks about purges. Polypody he puts as a purger as well, so presumably that might be a larger dose. And purges of choler. He talks about rhubarb and manna. Manna is a mild laxative. Rhubarb root is a stronger laxative. It's got anthraquinones in these substances which really stimulate the bowel. So pharmacologically, really, really interesting. And I think he goes on to list a bunch of formulae in here, which I won't read out, but some very sophisticated formulae that they had. And then the second book I just want to dip into is Robert Burton's Anatomy of Melancholy. And this whole book is brilliant. It's so etcerative and mad and wonderful. And he talks in the middle about the different ways of treating melancholy. And this is, I think, the beginning of the second book, or part 2 of the book, has this little flow chart, or quite big flow chart actually. And in this flow chart, it talks about the compounds altering melancholy, and then talks about purges and, I think, digesters. So I think in terms of purges, he goes vomits, upward as vomits, downward. And so in terms of upwards, he talks about hellebore, which is incredibly powerful, toxic plant, but very interesting one. There's some modern research suggesting it might have, at least in the laboratory, anti-cancer properties. And it also contains cardiac or heart active compounds. Antimony, which of course we wouldn't use nowadays, it's a heavy metal, which is highly toxic. And then more gentle ones for downward purges: senna, which is obviously still used today, polypody again, dodder, or Cuscuta epitimum, and then milder ones like fumitree, which is a herb that's still in use. So I mean, I could carry on, but the point is here that our ancestors did have these really interesting sort of systems that were empirical and very carefully worked out. And they might not stand up to scientific rigor, but I think in the sense that, in the sense that astrology doesn't, largely. There is some science in support of astrology, but the totality of the research doesn't support it. But I think what you can see in practice is that the way it would have been used is you have an astrological indication that you're looking out for. You see a patient or client where that indication is present in their symptoms and is matched by an astrological chart that you're using for that client. And then you have a set of strategies that can be employed pharmacologically to deal with that constellation of symptoms. Now, is that going to be accurate in terms of the pathology? Like, is that the same as a modern diagnosis? No. And obviously, this is no substitute for modern medicine in terms of its accuracy of diagnosis in a particular sense, but in a general sense, in terms of alleviating the symptoms. The interesting thing is this form of medicine was in use for I don't know, 3, 4,000 years, maybe longer. So the human race is still alive. So even if it weren't wildly successful, it's not all nonsense. There are all these plants have pharmacological activities by today's lights. And the formulae that they put together would have caused changes in the person's physiology in line with sort of to which would presumably have adjusted their symptoms in the proper direction. So this is something I can talk more about. I'm going to stop there. I feel like I've rambled a bit this evening, but hopefully this has been interesting to some of you at least. If you have liked this video, please, or this podcast, please leave me a like. Please do subscribe and share it. And please put in the comments anything you would like me to cover in the next one. All right. Thanks a lot, guys. Bye.